Thank you for being here. Well, we all knew it was coming. Flu season is back and the pandemic still lingers. Dr. Randy Murphy, our COVID expert with the Mobile County Health Department, is back with us live. Dr. Murphy, the number one question is, how do I tell the difference?
Well, it's not going to be easy. Unfortunately, we do have very good tests for COVID-19. So if you do have COVID, get a test. The tests are very good for COVID-19. The tests are less good for influenza, but you hit it on the nail, Cherish. If you have flu-like symptoms, fever, a little bit of a headache, runny nose, cough. I mean, these could be signs of COVID-19. They could be signs of influenza A or B, or they could be signs of some other respiratory viral infection.
And of course, we've heard for a while health experts are predicting a particularly bad flu season.
Yeah, last year we had one of the lowest influenzas, seasonal flu on record since those types of information and data started to be collected in 2005. So, but last year we had school closures and limits on occupancy and mask mandates. So we didn't have a vaccine back then, but because we've had very low uptake of the vaccine and we don't have mandates on those other prevention measures, we expect to see a really busy flu season this year. And so that, in combination with COVID, in combination with other respiratory virus for kids, in combination with, strep throat and other things that are circulating, it could be a bad winter.
And it is possible to get the flu and COVID at the same time. Talk to us about what happens then.
Yeah, that would be really unlucky, but it's certainly possible. So, we in those situations where there is no cure for influenza, right? We just treat the symptoms, ask people to rest, to drink lots of fluid, to treat with over-the-counter medicines that they can tolerate. And the most important thing is stay at home if you're sick. So if you have any of the symptoms of influenza or COVID, please stay at home and don't infect others.
And if you have the flu or have COVID, obviously your immune system is a little bit weaker, so I would think you'd have a better chance of developing the other.
Well, you really want to get vaccinated for both COVID and influenza to try to reduce your chance of getting infected, but most importantly to make sure or reduce the chances that you will have very severe illness if you do get COVID and or influenza at the same time. So again, vaccination for influenza and vaccination for COVID are still our best prevention measures, but you're still going to need to wear your mask and distance and wash your hands. And again, if you get sick, we need you to stay at home so that you're not out there giving flu and COVID to other people.
Should those shots be spaced out, the flu and COVID?
They don't need to be spaced out. So you can take the COVID shot and the influenza shot at the same time. I've been reminding people that, with COVID, we only have 3 vaccines, and it's usually up to the individual which vaccine to take because they are all very safe and very effective. For influenza, it's different. You need to talk to your doctor about what influenza vaccine is right for you. There are 9 different influenza vaccines on the market this year. Some of them are for certain age groups. Some of them, are for people who might have allergies. So it's really important to talk to your doctor or your pharmacist about which influenza product is right for you.
And you said something a moment ago that makes me want to bring up a misconception that I keep hearing time and time again. I'm vaccinated, so I don't need to wear a mask. I can't give you COVID, nor can I get it. Dr. Murphy?
Yeah, I hear that a lot too. And we just keep reminding everyone that, no vaccine is 100%. No vaccine is perfect. And the reason we didn't have a bad flu season last year is because we were all wearing our mask and
Yeah.
we were spacing. So, some people who get COVID vaccine will get COVID. We also know influenza vaccines usually have only about 65% success rate in preventing influenza. Again, they're great at reducing severity of illness. So I'm of the camp, like, do everything I can do to protect myself, and that's layering things on, getting a safe and effective vaccine, but then continuing to mask and distance when I'm around people that I don't know if they've been vaccinated or not.
Exactly. So there you have it. Still says masks are important as well as social distancing. Dr. Murphy, thank you so much once again for your insight.
You're welcome.